Dr. Ghias from Tono Health. I think we're going to have such an interesting conversation. I suppose from my perspective, I'm the founder of Hydramed Solutions that makes Hidrawear, and Dr. Ghias is the founder of Tono Health. And together, I suppose we're pioneering and really shifting our focus onto the HS community to improve patient outcomes and patient experience in the healthcare system. Hidrawear is the first HS-specific wound care product that's been developed for people with HS, and Tono Health is the first digital healthcare provider connecting HS specialist dermatologists with HS patients. So, Dr. Ghias, I think we're very much aligned in our objective to make things better for people with HS, and I'm really delighted to have you here today for a chat.
Yes, thank you so much for having me. I feel like we've known each other for years. I mean, literally dating back when the Detroit HS conference was at this point 5-6 years ago. So, it's been a while, and we both, stayed in touch and stayed committed, and it's great to be here. Thank you for having me.
Oh, thank you. So do you want to start just by telling me a little bit about your background, where you grew up and went to college?
Sure. So I grew up just outside of Washington, D.C. in Bethesda, Maryland. Then I went to undergrad at Emory University in Atlanta, Georgia. And then I went on to medical school at Albert Einstein College of Medicine in New York. And so while I was there, I did a year-long fellowship in HS, and I'm currently completing my dermatology residency. And I'm also involved in the HS Foundation, where I'm on the Impact Committee.
Wow, amazing. And what was it about HS that made you want to pursue it as a specialty?
I think it's always the patients and being able to reinstate hope. Because when I was at the HS Center, I got to know so many incredible people who had these really difficult and heartbreaking stories and journeys, spending decades of their life, being let down and giving up hope. And I was really motivated to change that. And I think one of the incredible things about HS right now is the amazing advances that we've had in terms of the treatment and management in the recent years. So, I really love knowing that when I treat patients, they will get better. I don't think that was always the case. And, it definitely doesn't happen overnight, but, knowing that over time they'll improve is really impactful. And just, knowing that you can make a huge difference in someone's life.
Did you experience patients who had challenges accessing HS specialist care? Or do you have any advice to someone who might have HS who is being seen by a clinician who's not familiar with the disease?
Yeah, absolutely. I mean, I think that most of the patients who we saw hadn't seen an HS specialist because they are few and far between. But, I think that we're really increasing and improving that over time. And there's a lot of efforts in getting more residents and dermatologists interested and knowledgeable on HS. I think the HS Foundation and the HS Connect do provide additional resources that can be helpful in navigating that. But yeah, I think that, that's really our goal as well, because even with this increase, there are still, huge areas where there aren't any specialists and where people struggle to access that care.
Okay. Do you see a lot of wounds, or what's been your experience of seeing patients with a wound care requirement? And what do you think, how big of an issue do you think that is for patients on a day-to-day basis?
Yeah, I mean, I think it is a huge issue, especially for the more moderate to severe patients. It is a really debilitating part of their care because it impacts every aspect of their life. Just even anecdotally, the first visit with patients, seeing what they're currently doing for their wound care and management, whether it's, just putting on a Band-Aid, but then it's painful when it's coming off, and, a more like DIY approach of like taking gauze and everything. And also even that ends up being so expensive. It's a huge area of need, which is why, I think a lot of people are both in need and loving Hidrawear's products, because it really gives them something that, it has been personally built and specially designed to meet those needs.
Yeah, thank you. Can we talk a little bit about Tono Health? Because I'm incredibly excited about the potential it has to really change the treatment journey for people with HS. Do you want to explain a little bit about what Tono Health is?
Yeah, absolutely. We started Tono about 2 years ago, and our goal was really to expand access to best-in-class specialty care for HS. So we built a medical practice that delivers care virtually. And using Tono, patients can go online, they can have a video visit with an HS expert doctor, and then we provide ongoing comprehensive care to really, fine-tune and personalize their regimen over time. And they get access to the same treatments and care that they would get from an in-person specialty center.
Amazing.
And one of the questions that we often get is, can HS really be treated virtually? And the answer is yes. The video visits and the intake really do give a lot of information that's needed to develop the comprehensive treatment plan. And then we have a lot of partnerships with local providers and labs to provide in-person care anytime as needed. But, it's really about bridging the areas of the map that are unable to be served, by the current amount of specialists.
Yeah. And as well, I think that the time to be able, or the time frame in which you can provide that consultation is fantastic, because I know for me, when I have a really bad flare up, sometimes I'll need to see a doctor, but by the time I actually get to see the doctor, the flare has calmed down. And then the doctor is like, it's not that bad. And I'm like, well, if you'd seen me a month ago, it would have been a different story. So I think that is remarkable.
Yeah, I also think that it's interesting to, even think about people's different definitions of like not that bad, because I think it's not really, I don't know, I feel like it needs to be almost like a partnership between the provider and the patient in discussing like, okay, how much of an impact is this having on your quality of life? How much pain are you in? And not just right at this exact moment, but also, thinking back over the past month or 2 months, et cetera, and really looking at the total picture, because it's so hard to capture everything that patients experience in just like, one snapshot of like a, 20-minute visit.
Why is Tono Health different to other services?
Yeah, so a few things that set us apart. So our doctors are HS specialists who really understand the patient's condition and can help address any unique needs. Also, as you mentioned, getting care in 3 days instead of having to wait months makes a huge difference. And just being able to do this from the comfort of their home instead of, having to travel far distances and needing to wait and take off of work, et cetera. Those things make a huge difference. Also, we've really designed Tono especially for HS patients to provide this comprehensive care, because we're really focused on treating the whole person. We know so many of our patients have unique needs, and we really want to go above and beyond to develop treatment plans that can address those needs. Hidrawear being a really great example of that. We know it's built for HS patients, and we know that people love it. So we work with them to incorporate these products and services that can not only improve their care, but also their quality of life.
Amazing. Oh, and who are the other doctors involved?
So we have a great group of HS experts. Just to name a few, Dr. Lowe's, who is one of the OGs, and she is very involved in the HS Foundation. Also, Dr. Cohen, who runs one of the largest specialty centers. And Dr. Lanzowski, she ran an HS center in Virginia, and she's also an expert in culinary medicine, which we've gotten a lot of questions and interest about. So that's been really great as well. We're also, we've recruited a lot of doctors that did fellowships in HS. So Dr. Solomon, for example, she did an HS fellowship the year before me. She's really amazing. And finally, I work with a group of dermatology experts that focus on teledermatology, such as Dr. Marmon. She's a teledermatology expert that I work with closely in New York City. And she's amazing. She's super helpful in basically helping us make sure that our system is really optimized for virtual care.
Oh, it sounds so good. I wish it was available in Ireland. Maybe one day.
Yes, exactly. Long-term goals.
What has the response been so far from patients using the platform?
So it's been overwhelmingly really, really amazing. I mean, patients love the convenience, not having to travel, take time at work, etc. They also love that it's covered by insurance, and they love that it works. I mean, patients are getting access to the best treatments from incredible doctors, and they're seeing amazing results. I also think that, on a more personal level, people really do love talking to a doctor that specializes in HS, like someone who can really understand, their experience, answer their questions, and deliver amazing care. That's, been a huge resounding piece of feedback. And some of the little tidbits that have been just, really stood out were a patient telling me that now she can be a better mom because she has more energy, because she's not in pain. Or, someone asking me if they can reschedule an appointment because things are going awesome and she's finally going on dates for the first time in years.
Amazing.
That's really the experiences that show us that, we're accomplishing our goal and, helping people live their best lives.
I love that. And I love also your dedication. It's so genuine. And I've known you over the years and we've met at different events, and your commitment to HS patients is unwavering. And I also love how open-minded you are about being open to discussing things outside of the very structured treatment guidelines that doctors adhere to, and just kind of being willing to have conversations with your patients about their dating lives. That's so wonderful. Or about, diet and exercise and things that may not be in the guidelines per se, but are still important for overall health and well-being. So thank you so much for just being such a great doctor for the HS community. You'd mentioned there about insurance, and I just wanted to understand a bit more about how that works for people using Tono Health.
Yeah. So we work with our patients' insurances for the medical visits, and for patients who don't have insurance, we'll work with them to find a way so that they can still get care. In terms of the treatments, those are usually covered, just like they would be in person. And just about, all of our patients have had their medications covered by their insurance. But if it isn't covered for some reason, we really go above and beyond to still get them the best treatment, whether that involves, filing appeals or doing a peer-to-peer or working with patient support programs. We really want to make sure that, we're doing everything possible to get them the best care that they need.
Amazing.
And it's also really exciting that, Hidrawear is covered by so many insurances, because patients love it. And that is a huge benefit for them.
Yeah. It's a very exciting time for us too. And I think the timing of, I suppose, even this conversation is just so wonderful, and I'm really looking forward to what the future holds for people with HS. Both in terms of accessing really specialized care on the Tono Health platform and accessing more appropriate wound care products to help them with their day-to-day lives, whether it's, for a short period of time while treatment comes into effect, or for a longer period of time or as required. And yeah, I think we've a lot of work done. We still have a lot more to do, but things have certainly changed even since the first time that we met. The amount of new treatments becoming available, and also the awareness of HS, I think is going to shorten the diagnostic delay and hopefully kind of have patients being treated by specialist providers or HS specialist physicians in a very timely manner. And so hopefully the future for HS patients is a lot brighter than it was for me when I was, 13 and starting to develop symptoms. And I think that really gives me a lot of hope for the future as well.
Yeah, I mean, I completely agree. I think that every year there has been, a exponential improvement in terms of just all aspects, whether it's awareness, the treatments, getting people the right care, also just people's experience, because, I think that a lot of patients who did experience that struggle are so dedicated to, making sure that that isn't the case for the younger generation, or just moving forward and, helping to make sure that we're just getting people the best care as soon as possible and able to, really intervene as early as possible to prevent any. Yeah.
So when you log on to Tono Health for the first time and you create an account, what happens next? What's the actual process like for the patient?
Yeah, absolutely. So when people log on, they make an account, they fill out basically an intake similar to, what would happen at an in-person visit. And then a member of our care team reaches out to get them scheduled for a video visit with one of the doctors. And then, from there, they have the video visit where they work with the doctor to develop a treatment plan and, as needed, getting prescriptions sent to their local pharmacy, or whether they use a delivery pharmacy, basically the same protocols as in person, but just changing the paradigm around the live video visit as like the main visit that's going on. And then, if they need any labs, we send their labs to us or LabCorp or whatever their, local lab is. And we also partner with, in-person providers for any procedures, or partner with surgeons that focus on HS, which has also been really amazing to, basically help to address all aspects of their care.
Amazing. All right. It really does sound fantastic. And I hope that anyone watching today will consider signing up if they need HS specialist care, because they will be in very good hands with Dr. Ghias and your team. Is there anything else that you want to talk about before we finish up?
Yeah, so a couple other things, that we have noticed. Yeah, I think that, our female doctors has been a huge bonus for many female patients. I mean, we're really proud and excited that we have so many incredible female doctors, and it's something that a lot of our patients have highlighted as being very important to them, given the intimate nature of HS. So that part has been really great. And also, we currently cover 27% of the US population and are expanding to over 50% in the next 3 months. So today we treat patients in New York, Florida, California, Maryland, Kansas, and in the next few months, we're expanding to Texas, Michigan, Pennsylvania, Louisiana, Virginia, and North Carolina. So lots of exciting expansion. Hopefully one day we'll also be in Ireland. But yes, we're, trying to get as many patients as possible the care that they need.
That's incredible. So for the states that you're currently in, run to your computer and sign up if you need HS specialist care. And for those that you're not in just yet, watch this space, because you will be soon. That's so exciting. And it's such a great time to be doing this as well, with kind of everything, and not everything, but a lot of our day-to-day lives moving online, and the convenience of it. Like, it really is very convenient to be able to have a consultation over a video call. You don't have to, you just take half an hour out of your day to go and do that. How long does it actually take to have a consultation typically?
I think, it depends a lot on the patient and the complexity. For more severe patients, maybe it would take a little bit longer, but I would say usually about 20 to 30 minutes. Someone is in a rush, I'm sure we could speed it up, but usually I think people like having that initial visit be, around 30 minutes just to really establish rapport and to, build and construct the treatment plan, to go over, what causes HS, why are we using the treatments that we're using, and like how did we come up with, this treatment regimen? Because I think, that's something that is often lost in a lot of, a rapid visit is like, I don't know, I feel like it's bizarre to expect people to like do something every single day without telling them the why of like this plan and this treatment regimens.
Is there a treatment pathway that's designed for patients with HS, and what is it?
Yeah, I mean, so again, I think that part ends up being very patient and provider specific, because I feel like the thing about HS is, it's so multifactorial and there's a lot of nuances that are, that we want to develop a really personalized approach in how we treat patients. So I feel like, almost following a North Star that like no two patients are exactly the same, and being able to figure out, okay, like, do you have flares from X, Y, and Z, and like asking the right questions and being able to fine tune that based on those responses makes a really huge difference. And, I think there has been a little bit of a shift into like less of a reactive approach to treating HS, like not necessarily waiting until everything is super severe and there's a lot of irreversible scarring to introduce the idea or even optionality of a biologic or something, and instead maybe being a little bit more proactive. But I think again, it's a lot of conversing with the patient about their goals and seeing like the complete picture of what's going on, and then together being able to like formulate a plan that is aligned with like their values and goals and the physician's recommendation based on like all of that information.
Yeah, that sounds so great. It really sounds like a collaborative effort between the patient and the physician to ensure the best outcome for the patient. And I think that's really unique. Maybe not in the broader picture in the US, but it's a really nice approach. Including the patient voice in the treatment journey is wonderful.
Yeah, or even just, listening or like asking if a patient is, very anti-X treatment, just being like, oh, well, I'm just curious, like, why? Learning what that why is sometimes enough to be like, oh, well, actually, that is not true. Or, there's so much misinformation that goes on. And, just being able to have an open dialogue and an open conversation about like what their reasoning is, what my reasoning is, what, like the pros and cons are, and making it a little bit more collaborative, I think can go a long way.
Yeah, right. Well, look, I think it sounds like enormous step in the right direction for treating patients with HS and other inflammatory skin diseases. And then who knows, as your organization grows. But I wish you the very best. I'm really delighted to be collaborating on this with you and excited for the future. So thanks so much, Dr. Ghias, and hope to see you soon.
Yes, sounds great. Thank you for having me.
Okay.
All right.
Bye.